Okay. All right. Basically, what I'm going to start out with a brief overview of kind of the Ohio Colleges of Medicine Government Resource Center, what we do at GRC, and what are some of the opportunities for Ohio Medicaid and the academic medical centers and other universities and colleges to partner. We will talk briefly about the Ohio Colleges of Medicine Advisory Council, who's helping us with this project that we'll be discussing today, and then provide you with a brief overview of the MedTap program and how the financing works. Then Mina Chang is going to talk to you about some of the current interests and priorities of the Ohio Medicaid program, including the new quality agenda. All right. GRC was actually created by the Council of Medical School Deans in 2008, and our purpose is to create partnerships between state health and human service agencies and the academic medical centers to match university faculty and staff expertise with state agency technical assistance needs. We are housed at Ohio State University. However, we actually represent all of the colleges of medicine in this work, and we'd like to extend that relationship with other colleges and universities who may not be affiliated with colleges of medicine but have programs relevant to public health care as well. These are some of the programs that we are aware of and are trying to engage in our work. We have colleges of medicine, pharmacy, dentistry, public health, optometry, nursing, schools of allied medical professionals, different research centers, and non-academic medical center resources such as other colleges and public universities without medical schools. The goals of this program are to create a mutually beneficial partnership that utilizes Ohio's academic medical center and other university health science resources to develop research and technical assistance to support Medicaid administration and enhance the clinical, professional, and policy resources available to the state, and overall to support the efficient and effective administration of the Medicaid program. This partnership provides opportunities to the academic medical centers and other universities that participate, and I'll just briefly describe what those are. First of all, funding can be used to support service and service learning opportunities, to enhance the university's reputation by supporting building of expertise in specific health-relevant areas, improve the financial performance and resources to subsidize university education and service missions, provide opportunities for innovation and strategic growth, and foster potential workforce capacity for serving Medicaid and other underserved populations. In terms of benefits to the state, there are many. Certainly this partnership increases Ohio Medicaid's ability and capacity to do a number of functions that are critical to the program, including increasing capacity for policy and data analysis, program planning and design, cost savings and cost avoidance strategies, figuring out how to use and improve the technology, and then improving use of care, increasing its efficiency and effectiveness, using evidence-based improvement science, evidence-based practices, and recruiting, developing, and retaining a strong healthcare workforce. The Government Resource Center is working with Ohio Medicaid to support and create these relationships, and GRC actually has some existing agreements already with Ohio Medicaid. And this slide basically shows you the scope of those existing agreements. We provide rapid technical assistance and consultation services Our role on projects typically involves kind of project administration, project management. We act as fiscal agent services. We certify the non-federal matching funds to pull down federal financial participation to support projects. And we create kind of an inventory of resources trying to identify staff and faculty and programs around the state that could support Medicaid's goals. So we're developing an inventory of those resources, and that's actually the purpose of this meeting today. We are advised by the Ohio Colleges of Medicine Advisory Council. They are helping us in the work of identifying faculty and staff who can provide technical assistance to the Ohio Medicaid program. They are also identifying ongoing activities and initiatives at their universities that could be expanded or enhanced to improve services to Medicaid-eligible Ohioans. And then they're also helping us to kind of foster the partnerships with Ohio Colleges of Medicine, other public universities, and GRC in order to develop contracts and strengthen this partnership. We are currently developing an expertise inventory to identify faculty, staff, and programs at each university that match the priorities and needs of the Medicaid program. We have been traveling actually around the state and conducting meetings like this webinar with different groups at the academic medical centers, but we also hope to engage the public universities around Ohio in this effort. We are hoping to complete an initial electronic inventory of resources by the end of this month. So we are kind of rapidly at this point trying to reach out to as many faculty and staff at colleges and universities as we can to ask them to complete an electronic inventory that's actually posted via SurveyMonkey online. And actually the information, the link for that site is in the email that invited you to this meeting. And we're asking faculty to complete that survey actually within the next week so that we can get kind of an initial overview of the resources available in the state to provide to Medicaid by the end of June. Okay. This slide is kind of a visual depiction of our relationship with Ohio Medicaid and the academic medical centers, and you could also include other colleges and universities in there. Basically, Ohio Medicaid works through the Board of Regents and the Government Resource Center to contract with the academic medical centers. Ohio Medicaid provides the policy direction and communicates needs and priorities, and looks to the academic medical centers and other universities to provide various types of technical assistance, consulting services, research evaluation, et cetera, to support those needs.